And welcome back. We are about to get into our first segment for this morning. Of course, the U.S. Embassy to Belize closes the Beyond the Horizon project. And to tell us more about it, in with us, we have got none other than Adrienne Galanek, who is the Chargé d'Affaires at the U.S. Embassy, Honorable Angel Campos, who is the Minister of State and the Ministry of Health, Lieutenant Colonel Rob Ramsey, who we've met already, of course, Military Liaison Officer at the U.S. Embassy, and none other than the Brigadier General David Jones, Commander of the BDF. Guys, good morning and welcome.
Good morning. Good morning. Thanks for having us here.
Everybody seems to have that additional energy that we need on a Thursday morning, which is, of course, very good. Now, while we close this project, can you share with us what the project was about? The Beyond the Horizon Collaborative Training Project.
Thank you, Marlene and John, for having us here this morning, and thank you also for your work in supporting the Beyond the Horizon partnership.
You're welcome.
So it's a partnership exercise with the government and people of Belize, and with the U.S. military, and also the people of the United States. And we're very thankful to Belize for welcoming the teams here, thankful to Brigadier General Jones for his leadership and the BDF support and the teaching that they did for the troops, and also for Minister Campos and the Ministry of Health, as well as the Ministry of Education. So it's a collaborative exercise that builds health and education infrastructure here in Belize, and also provides medical services. So there were 3 new clinics, so one in Ladyville, one in Doublehead Cabbage, and then an expansion for the Western Regional Hospital in Belmopan, an expansion of the emergency wing. And also a medical incinerator was also installed there. And then there were 3 different medical service sites in Dangriga, in Ladyville, and in San Ignacio. And all told, we're very, very proud, in partnership with the BDF and the Ministry of Health, and doctors and nurses, and many, many volunteers. All told, almost 17,000 patients were seen.
Wow.
The last time you were here, you were moving into San Ignacio, then Dangriga. Let's just get a little bit of a recap as to how the medical services mission unfolded in those 2 areas.
Okay, thank you. And also, I'd like to say thank you for having us on again. So, you know, the way we see it is, this is a learning experience. It's a growing experience. Each medical readiness, what we call medical readiness training exercise, got a little bit better. I feel. We were able to, we started off in Ladyville, then went to San Ignacio, and you could just see improvements, more community involvement. We got better at what we were doing. By the time we went to Dangriga, I believe we saw approximately 8,000 patients. Wow. So we just saw continuous improvement, community involvement. NGOs, we had volunteers from colleges in the United States coming out there. Once people heard about it, and definitely the social media helped, being on TV helped promote what we were trying to do. So really just total improvements, and we view this as a training exercise for us. We get to deploy to a country, provide services, so it's a win-win. It's a win for the U.S. Government, the military, and also for the people of Belize.
Now, let's talk about the collaborative training exercise from the Ministry of Defense perspective. Obviously, this is an exercise that has been done for a while. Brigadier General, tell us a bit about how you identify needs and areas of cooperation that the militaries can be able to work together with.
Okay, first of all, good morning to everyone.
Thank you.
Thanks for having me here on the show. I'd like to say, first of all, a big thank you to the U.S. government, because it starts with the policies that are set down by the governments, and the partnership that the U.S. government has with the Belize government is very strong. And the decision was made that Beyond the Horizon was going to be in Belize this year, which was great. It's been over a year since I got the news, and that is when myself and General Chin, who is the commander for Army South, who commands the troops that are now here in Belize, started the planning. The cooperation was done with the U.S. Embassy here, Ministry of Health, and also, of course, the Ministry of Defense. To have the Belize Defense Force be a part of this exercise. So the troops that actually do the work would be the militaries from both countries. And they deserve a lot of congratulations on the work that they've done, because it has been a fantastic job. And they can be proud of the legacy they're going to leave behind here in Belize, because the buildings are beautifully built. They're going to serve an excellent purpose to the people of Belize and the community. It has been hard work. These guys came here in the Belizean heat and it was very hot. During those days, during construction here in Belize, was very hot this year. And when I visited the guys, you can see them sweating, you see them taking their clothes off to try and cool down, get their water breaks, go back on the job, work again. And at the end, there's great satisfaction for both the BDF and the US military. It's an excellent opportunity for the BDF. We got to welcome US forces, and we saw different rotational segments from the US military coming through, in excess of over 2,000 US soldiers coming through to work with the Belize Defense Force. And so our soldiers got to meet a lot of characters, different people. They exchanged ideas, they made friendships. And those friendships are going to be lasting. But it was an excellent opportunity to receive forces from abroad, work with them on a humanitarian project. But the better satisfaction is the constructive work that they have done, to see the results of it, and the people that are going to benefit from it, and that is making them very happy.
Of course. You know, and I think it's very easy to recognize how this kind of work helps to build a relationship with the communities that you go into as well. I want you to talk a bit about those particular benefits, having the Belizean military forces in these areas for such for a period of time, giving back.
Great question. It has been an excellent opportunity for recruitment for the Belize Defense Force. And also, by extension, recruitment for soldiers who wants to go and live abroad to also join the U.S. Army. Because we do have Belizeans who have left Belize and have joined the U.S. Army. On a daily basis, the community interact with these soldiers. The school children that are close by, they go close to the construction site. They talk to the soldiers, they eat with them, they drink with them, and they talk with them. So the soldiers from the U.S. Army get to understand the culture and the people of Belize by interacting with these kids, and with the members of the community, the teachers, the nurses who go around and talk to them. So it was a great experience for the U.S. soldiers. Excellent relationship for the Belize Defense Force, because they got to interact with the community. So our local people got to know more about our soldiers, what our soldiers go through, and they seen the productive work that they've done, not just the traditional military role of doing patrolling or being in conflict, but seeing a constructive side of what the military can do. So the young boys were very happy to go around and to meet the forces, both from the Belize Defense Force and the U.S. military.
You know, I've seen especially the work there on the George Price Highway, and I've seen how the people interact with the soldiers. And I've got to say kudos to the BDF and of course the U.S. Army, military actually, for actually rolling that out. So folks could know it's not only about holding a gun or being in combat, you're actually doing your hands-on jobs that you would want to be in. But then again, you're in a uniform. So it's actually a great feeling. But I wanted to jump to the perspective of the Ministry of Health. Honorable Campos, give us a perspective from the Ministry of Health. What is this like for you, and how significant this was for Belize?
Good morning.
Good morning.
First of all, good morning. Thank you for having us on the show, especially. I think this is my first time here.
Yes.
You know,
welcome.
Thank you. From the perspective of the Ministry of Health, this is a very good partnership. It really, the U.S. military, the U.S. Embassy, really put a grain of sand in all that they did to put a paw print here in the Ministry of Health and in Belize, especially in Belmopan, where they built a brand new wing for an expansion for the emergency room in Belmopan, which was badly needed. You know, we have an ever-growing population, especially in Belmopan, and the health facility there was getting too small for that population. And with this expansion, it will impact a lot of people. Not only the Belizean people, but also our doctors and nurses and the ones that work in the hospital. because the hospital was getting too small. If you have an emergency and you have, let's say you have a RT, a road traffic accident, and you have 3-4 persons that you need to take care of, the emergency room was it was getting too small.
Yeah.
You could barely move in there. So with this expansion, the doctors and nurses have more room and they can better serve the persons there. So it really caused a big impact. The incinerator as well, you know, we have a little bit of problems disposing our red waste. You know, we need an incinerator to dispose properly our red waste, thinking on environmental impact, thinking on combating different infectious diseases. You know, so that is very, very helpful. And the impact that the medical brigades did, the medical fairs that they did in Ladyville, in Cayo, in Dangraga really impacted, like Mr. Adrienne said, almost 17,000 persons. You know, so this is a very good thing, and it really impacted the hearts of our people. They had specialists. They saw family medicine, general consultations, specialist consultation, gynecology, obstetrics, pediatrics. We had even dentists, we have the optometry, and even one of our Belizean doctors helped in the optometry in Cayo. So it was a very good experience, not only through the Ministry of Health, but you can see the community collaboration. It was something that I think it's first in its class, because we have had various medical brigades coming in. You know, we have the Cuban brigade here as well that do have a lot of impact in our people. But when you see these brigades where the people come out and interact with soldiers, interact with doctors, you know, interact with our BDF, I mean, it's really astonishing.
Yeah, 17,000 is quite a big impact. Congratulations to you guys. And we know it was a well-coordinated event. And of course, as a free service, it was definitely something that we're glad people took advantage of. I want to talk for a bit, Honorable Campos, just a bit about the infrastructure projects that have been put in place. You spoke about the Western Regional. In terms of this collaborative effort, what is the commitment from the Ministry of Health to be able to adequately equip with human resource and additional equipment if necessary?
Ministry of Health is aware of the lack of human resources. We are trying to get the funds so that we can put that human resources as well. It was one of the commitments that was done, you know.
Nobody wants we appreciate the buildings, but we want them used.
Yes, and we have had that vision in the Ministry of Health of seeing how we can put the workforce and the equipment. We have even, I think it's an American company that will be giving some of the equipment for the project as well. Okay. So we will have equipment. Ministry of Health is acquiring equipment not only for Belmopan, but if you know, we have the polyclinic in San Narciso, so the polyclinic in Chonoch that was building through the SIF projects that are getting equipment as well, and we're getting to all other facilities in Belize. So we are trying to see how we can better the health services in all of Belize.
Yeah. Go ahead. So there has been an additional partnership with a private company, I guess. Yeah.
Well, actually with NGOs. And so there's actually a part of U.S. Southern Command that's dedicated to building partnerships. Yeah. It's called the J9. And what the J9 does is it works with academic institutions as well as NGOs and the private sector. Because our challenge, and Colonel can probably speak more to it, is that we can build this infrastructure, but there's no funding within the military to equip it. So that's where that other part of the dimension of the partnership comes into play. So we're very lucky that Direct Relief has partnered with us on this, and they will be providing pharmaceuticals. They're either in country or very close to being in country. And then Project Cure is providing equipment as well as SAGE and medical supplies overseas. And for St. Matthew's School, we're also very lucky. We partnered with Global Aid as well as Midwest Schools, I believe, and Church of Latter-day Saints, as well as shoes to provide desks and other necessary equipment for those wonderful classrooms. So.
You were speaking about the additional partnerships that you were able to build outside of this particular project?
Yeah, so outside of this project, like Chargé mentioned, the NGO support was incredible. Also, and I don't want to steal anybody's thunder here, but really, it's about like I'm sure the Chargé would mention about people and about community.
Yeah.
So, we didn't. I wouldn't say we built, but we kind of improved upon partnerships that we've had. There have been some new partnerships, obviously established with NGOs, but really, to me, it's about community, getting out there, bringing folks together for one common purpose.
Yeah.
Whether it's we did a huge project at Western Regional Hospital. So if you go past there, it's totally improved with a new parking lot, expanded parking lot, a new entrance. We put handrails on some of the buildings that didn't currently have them. There's a children's waiting area that was painted by a volunteer from a U.S. service member, two actually, painted murals on the wall, improved the playground, painted it, put new swings, ropes, chains, the gazebo. So all of these is really about bringing the community together to make improvements, for the hospital, but really it's for them, it's for the people, for the patients.
And Colonel Ramsey, can you talk a little bit about the people that you worked with to make that happen?
So yes, we worked with the mayor of Belmopan and the Belmopan City Council.
Yeah.
They gave 30 truckloads of gravel. We actually need more gravel, so if anybody's listening, we can always use more gravel. It required about 100 truckloads, and we're about halfway there.
Okay.
We can make it work with what we have, but so we work with them. We work with Global Steel Belize, donating all the new signs that are going up currently to indicate the new traffic pattern. Midwest Steel donated culvert pipes. Tim and Anna Smith from Twin Palms, also culvert pipes. They helped also coordinate a lot of donations because it's really difficult. I'm a small office, but really when we can get other folks out there to spread the word for us, it helps out a lot.
And what was it like trying to get the buy-in from the local private sector to be able to support the project?
It sounds like it would be hard, but once you start talking about it, and if your heart's in it, they can see that. And we had absolutely no problem getting volunteers. And if there's a Mr. Sutherland out there listening, this mysterious man, he donated, I think, 4 truckloads of gravel, which is quite expensive aggregate here in Belize. So folks that I don't even know who they are, that they started coming out of the woodwork, literally, and it's just been amazing. A BEL with removing all the trees that were out front, they did that. There were 60-foot cedar tree, pine trees. They cut them down. And then the city council provided dump trucks. We hauled them away.
Yeah.
We had schools out there, the U.S. Embassy out there, volunteers on a hot Saturday, and we removed everything. And it is absolutely incredible, and we're very proud to be part of that.
Yeah.
Success stories, of course, definitely one that we're proud of ourselves in here at 5 to eventually roll out to the public. So that, of course, or this, of course, is a success story. But I wanted to get back to the medical aspect of it in terms of what we did, or what you guys did in Ladyville, what you did in San Ignacio, but the masses came out in the southern part of our country. It's very difficult to get folks to eventually, especially being in remote areas, to come out for medical attention. You've been there, you've been out there. What are you seeing medically in Belize, and how do you think that we could eventually get this, roll it out so folks could know that, you know what, medically, you need to take care of this? What have you guys seen, mostly?
So, thank you. Great question. So, one of the things we do, and why we had so much more success in Dan Grieger, I feel, it's kind of like a snowball. Snowball's probably a bad analogy to use in Belize, but in the United States, but you start rolling it, and that's what we did with the informations campaign. We started out in Ladyville, and we saw a good number of patients, but really as we continued to get the word out, in the schools and the communities, going to meeting with different community leaders. So it really that's why I say it snowballs. So by the time and if we had a fourth medical clinic, free medical clinic, I can guarantee the numbers would have been over 8,000. Yeah. So one of the things too we're going to attempt to do is to do these medical readiness training exercises, the free medical clinics, more frequently. So there's a great partnership that General Jones has with General Curtis of the Louisiana National Guard. So this is something that we've brought up to them. So see if we can do at least an annual exercise like this to provide these free clinics. And then that will give us the flexibility to go beyond Dandrito, but really down south. And even in Dandrito, what they did is they worked with bus companies, with city councils to bus patients and students in free of charge. We were out there literally asking bus drivers if they could help out. And like I said, it sounds difficult, but once they see that you're serious about this, and that what you're doing is good for the Belize population, the outpouring of people and their donations and their of time and resources, it's just absolutely incredible.
What would you say is the greatest takeaway for the U.S. soldiers who participate?
So we view this whole thing as a training exercise. Most of these soldiers you see, and I have to say, I'm in the U.S. Army, so I'm biased, but we also, we have the U.S. Marine Corps, the United States Air Force, we had Navy corpsmen here, we had the National Guard, Army reservists. So it's not, we say Army South because they were down here executing, but really it was a partnership, it's a joint exercise all through the U.S. services. And then also we had Trinidad and Tobago and Colombia out there every day with us. And in Trinidad and Tobago, they're still in country today. They've been with us the whole exercise. But really I lost my train of thought.
You were saying
What we gain out of it, the Army reservists and a lot of the Marine reservists and Air Force reservists, they have normal 9-to-5 jobs, so they don't necessarily get out there very often and to do what they had previously been trained to do in the U.S. military. So this gets them to hone their skills. And also, from every service member I talked to that have been working on these engineer projects, and also the medical readiness training exercise, they said they felt like they learned more than they talked. So the BDF, the Light Engineer Company, great group of engineers there, but they might do things a little bit differently. So we've learned how to do things differently. In some instances, better. Things, in Belize, they dry quicker, so you might lay CMU block a little bit differently than you do in a cooler environment.
Yeah.
And for Brigadier General Jones, you did mention that, this was actually an eye-opener for some of these guys who were actually in these villages or these areas where these work were actually carried out. What would you say, especially for the next intake, because I'm sure it's going to be a big one, especially after this, but what do you say would be some of the not experiences, but some of the takeaways or the best way fit for these guys in terms of the experience that they've seen with the U.S. military and the BDF and how work are actually rolling out? Why would you recruit somebody and say, you know what, this is why, these are some of the things that you could do? Well, at the BDF.
The main thing we normally do when it comes to recruiting is have our young boys and ladies join the force to serve their country first. There's a lot happening in our country security-wise, and they can play a very important role by being part of one of our security force, and in particular for the Belize Defense Force. And it is shown a different dimension when we have exercises like Beyond the Horizons. The experiences that they have taken away is the most important, because having to deploy on a non-traditional role, which is a humanitarian effort, is different for the regular soldier. It's not something that they're used to or what they would expect to be doing if they join the Belize Defense Force. But it shows the variety of skills and things that we're involved in, not just military precision and military exercise and operations, but There are other productive things you can do when you're not in conflict, when you're not on operations. And having to see buildings being constructed after 3.5 or 3 months or so is a very satisfactory feeling that the soldiers get. So the young boys and girls that are out there who firsthand have seen what the Belize Defense Force have been doing with the U.S. Army Forces, it is a career-changing thing for them, even young in primary school. When I went to St. Matthew's school when we were doing the construction, I spoke to the entire school when I was there and the teachers. And I asked the students what they wanted to do after they leave school, and most of the boys, surprisingly a number of the girls, want to join the BDF.
It's all that exposure.
That's great for us. It's great for
to
us.
these people in uniform. So I want to ask just a couple more questions before we start to wrap up the conversation. Honorable Campos, one of the things I asked earlier was about the commitment to human resource, and you've already sourced some of your equipment. Is there a timeline in place in terms of being able to get to that point where perhaps the clinics or the expansions will be fully functional?
Yes, we have been working diligently in the Ministry of Health. CEO is looking at it very enthusiastic. No, we do need and I think that it's going to continue because they need to connect where they did the expansion to the emergency room. So I think we have another donation. So when that is done, that's when we will have everything in place. We just can't put the people there right now, but we are working on it. As soon as that is finished, I think we will be having everything in place.
It's definitely a great addition to have people in less urban areas to have access to healthcare. Adrienne, when you talk about the total investment from Beyond the Horizon, what are we looking at?
Well, that's always my favorite question. Because yes, you can quantify it in dollars and cents, and that amount is 11.5 million US dollars. That takes into account everything, the costs of bringing over 2,000 servicemen and women here, the equipment, the construction, all of those costs. But really the real answer to that, Marlene, is it's priceless. It really is. You can't put a price tag on the partnership that we've had, the success, really just reaching the different communities, working with the communities, and the response from the communities. I can't say enough about this partnership, and I'm really sad to see the teams go, but our partnership of course continues. And as Minister said, we'll go on to second phase at Western Regional Hospital, and we're not going anywhere. But
so we won't see the mass troops, but the relationship continues.
Of course.
And obviously, is there anything else you'd like to say about just you spoke about the communities coming out, you spoke about the private sector stepping up, and as much as you have committed from your end, it seems that the Belizean community tried to do the same. Anybody you'd like to say thank you to at this point before we close off?
Most in particular, I'd like to say thanks to the task force commander who was in charge from the U.S. Forces, Colonel Simmer. His leadership has been outstanding. The officers and soldiers of the Belize Defense Force that work with these guys, in particular the men who actually did the work, I'd like to publicly say thank you to all of them, because as an engineer I am biased as well to construction and I get great satisfaction after a construction project is finished, and I know how these men are feeling, and I know what they went through to be toiling in the Belizean heat to eventually see this. And I actually saw some of the BDF soldiers after the work was done taking their cell phones and going room by room to look at what they were doing and having that record of what they did. So it's going to be a legacy for them. Eventually, years from now, they can go back and say, this is what I was a part of, this is what I built. Interestingly, there were 2 service members from the U.S. Forces that was here with me 22 years ago when we did the construction of the school at Double Head Cabbage. I was a part of the construction team 22 years ago with those same 2 guys, and they were here on this construction project. So it was great to see them again.
So you know the sense of pride that they will
So I know what they're feeling now, and I'm saying thank you to all of them.
All right. Any other thank yous?
Oh my gosh, how much time do we have?
The abridged version.
I can't even begin. I put my remarks together for the closing, and it all is thank you, and and just the unsung volunteers. There's a lady, Miss Martha, who has for 17 years been volunteering at Southern Regional Hospital, and she owned our check-in area. And we can't say thank you enough. Miss Allison Jones in Dangriga, who got the students out. We saw 20 different schools at the different sites, but volunteers like that.
Yeah.
Mr. Kent McKenzie from Mac Rentals, who donated all the latrines and the tents and the chairs and serviced them, and anything you needed. Ryan Robel from U.S. Chamber of Commerce, tents. Dr. Monique Lovell, when we couldn't service enough, we had such great demand in San Ignacio for ophthalmology services, we couldn't meet it. And Dr. Monique Lovell came out and worked with the patients to expand services. I can't even put a price tag on that.
Yeah.
And also, of course, thank you to the BDF, the Ministry of Health, the Ministry of Education, and again, thank you also to the media, because without you, we couldn't have gotten the word out as successfully as we could have. And thanks to Colonel Ramsey, whose really vision at Western Regional Hospital made those extra projects happen about the new entrance and the gravel, and working with our civil affairs teams who are here. Thank you. Thanks to everyone.
The Western Regional staff as well. Nurse Guerra,
Absolutely.
Chief of Staff, Mr. Dr. Godoy. They were very, very enthusiastic and very helpful as well. It was something that they really got involved, and now I think they are proud of Western Regional Hospital, the way it's looking, and I think they have more vision on how to expand as well. So thanks to them as well, and thanks to Adrienne, thanks to Colonel Ramsey, the U.S. Army, and all the military from the U.S. and the BDF. Would like to thank them as well.
Okay, thank you. First, thanks to you for having us here.
Yeah.
And thanks Belize for hosting us, and especially to Brigadier General Jones. So the task force has been pretty much turned Price Barracks upside down. I think with 2,000 soldiers there, and then plus the British coming in and out, it is incredible the amount of support that General Jones and his staff has given to all of Beyond the Horizons Task Force Jaguar. So thank you, General Jones. And also, I just have to add this one thing. So we talked a lot about Western Regional, so I just want to say one more thing. We did recognize, after talking with Dr. Godoy and Ms. Bernadette at Western Regional, that really that emergency room expansion was a little bit too far away. So we found some money, but then we didn't have anybody to do the work. So that, like I said, things are too easy sometimes. And so I went to Captain Ramirez, the light engineer, company commander in the BDF, and I talked to him about it and others, and he said, we can do this. So they drew up the plans, the design, 100%. Right now we're just waiting on building materials. Once we get this, and he's calling me daily, do we have the stuff? Do we have the stuff?
So they're ready
It's
to
coming.
work.
They're waiting,
Yeah.
and they don't want to waste any momentum.
Yeah.
They want to continue this project. They see the need, and once that project is complete, really Western Regional will be transformed. So, thank you, Belize. Thank you, General Jones.
All right, thank you as well, and thank you all for stopping in. It was a full house this morning, but we're glad for all the information and kind of the recap of months of work that you've been doing, and I'm sure much longer planning. So thank you once again.
Thank you.
We're going to go ahead and take a break.
Yep, we're going ahead and take a break, and when we come back, it's going to be that lady that we always wanted to see, Judy Boucher. Stay with us. We'll be right back.